All right. Well, we will go live with YouTube. LinkedIn is apparently having issues today. So anyway, we will record this live on YouTube and we'll share later with everyone on LinkedIn. So if you're joining us from YouTube, welcome to episode 8. This is our mid-year checkup. If you're new, this is Interoperability Unlocked, where we share insights from sort of the intersection of trust and community, and then chat all things interop. I'm Courtney Baker, the marketing manager here at Commonwealth, and I'm always joined by our director of product, Liz Lewis. So as I mentioned, this week we're sort of embracing that we're halfway through 2025, which is actually crazy. But there's a lot of accomplishments that we've made so far in just the first 6 months of the year. We've got lots of new members that we're super excited about, successful migrations. And then Liz, I know you're kind of closely watching the progress in potentially pitfalls of what's been happening in the industry. So what's on your list so far?
Yeah, so far this year, trust and community are definitely high on my list, but I think that that's pretty standard. They probably always will be, alongside of continuing to push on patient access or IAS. Everyone, not everyone, but I've heard a lot of comments swirling around information blocking and sort of what's going on in that space, or maybe the lack thereof, the realization of TEFCA, and obviously, as everyone knows, there's this huge, Medicaid, Medicare bill that's poised to impact the healthcare, industry. To what extent we'll see, but how it will impact interoperability, sort of remains to be seen, but is something that I think, like many, will continue to monitor as it progresses.
Yeah, absolutely. So let's just start with some of like the overall industry updates for context of things that we're excited about here at Commonwealth.
Yeah, so I wanted to pull this up and share. I was looking at this article the other day, and we are obviously we've talked about patient access before. We have an upcoming meeting or upcoming show. Yeah. Next week, I think we'll continue to talk about patient access and patient identity. But I thought this was really cool. There's definitely more engagement from patients in their own healthcare journey. And that's really motivating and sort of helps make me at least feel that we're moving in the right direction for kind of pushing a patient's right to access their data digitally. Now, this is specific to mostly just accessing records via the patient portal, but that's still a really great start. So some of the stats from this article that I thought were really interesting. 65% of individuals accessed patient information online at least once in 2024, which was up from 57%. And, the proxy access, which is something that I don't think that we've really solved for well in the patient access use case, but is something that certainly is talked about and something that we recognize needs to have a better solution. So I'm a proxy, I'm a caregiver for my parent, my spouse, my child, etc. And I'm accessing their data on their behalf as their caregiver. That's something that, again, has increased really significantly, which is fantastic to see. So this article goes through, a lot of changes in the patient access space, and there's some, implementation around cures and whether or not the patient access APIs are helping with that. But ultimately, I think we're seeing a movement in the right direction with patients being more engaged in their healthcare. So really great article, and encourage people to check that out.
Yeah, for sure. I mean, I went to an appointment, was it 2 weeks ago, and I got the message from my provider in my portal that my test results were in, and I'm still getting text messages from like my portal reminding me that I have new test results in there. So there's just multiple different avenues that they're reminding you that you have this access to, which I don't remember getting like even last year, that many like reminders of being able to access my information in my patient portal. So yeah. Movement and progress anyway. So I'm sure that contributes to why the increase in access has happened. So But let's talk about information blocking a little bit. If you look back from like the beginning of the year to now, has anything really changed with info blocking?
Yeah, I mean, I wish that I could say yes. And I think, these two things are maybe a little bit correlated. We see an increase in people being able to access their medical data through patient portals, which is cool.
Yeah.
But really, information blocking sort of had this promise of, a very real stick, if you will, a very real penalty for making data difficult or just difficult to access or just not, able to at all. And what we've seen, I have some stats here. There's not a lot that's changed. There was some talk when we were in early June at the ASTP CMS kind of joint listening session, but not a lot. So there's a report online that says that it's on ASTP's website. Between April 2021 and May of this year, there have been over 1,300 claims of info blocking. Only 80 of those have been determined to be unlikely to be info blocking, which means over 1,200 claims exist out there of potential info blocking. And, I don't really know what to make of that,
Yeah. What are we supposed to do with that? Or
Well,
what's there to be done about it?
yeah, the only thing that we're seeing is outside of the federal space, and that's lawsuits. So we are seeing information blocking being cited in lawsuits. And I feel like we're going to continue to see that route be taken, but that's going to be taken, between entities that have, the financial ability, right, to kind of
Yeah.
file those types of lawsuits. And ultimately, it feels like the patient is the one who suffers when data is not easily accessible.
Right.
So I think,
Yeah.
there's a few lawsuits right now that are alleging some complaints or some companies are, you know, doing information blocking or not making data accessible or not making it easy to integrate into those systems. So we'll have to see what the outcome or outcomes of those different lawsuits are.
Yeah.
And that's going to set a precedent, I think, for how we move forward in this kind of info blocking world where we have a regulation, but we've yet to see real enforcement at the federal level.
Yeah. Only time will tell. And unfortunately, it's a slow moving time in that space. So, so there's a latest FAQ that is on like the healthit.gov website. And it says, would it be considered an interference under the information blocking regulations if a health IT developer of certified health IT limited a customer's or a user's choice of QHINs for the purposes of participating in TEFCA? What do you think?
Yeah. Really interesting. And I think that the answer to that on the FAQ was yes. It could be considered information blocking to limit access by saying no, like you have to use this QHIN over another. There's a really good example of Kanza National Network has, really strong in the HIE space and has a lot of provider organizations connected to it. A lot of those provider organizations use EHRs that may be connected elsewhere. And so there's a lot of talk about this. And so choice matters. And I think we need to keep that in mind, as we're kind of trying to navigate throughout this space. But I also think that if there's a limitation placed on a group of users to only leverage one QHIN, and that QHIN does not participate in certain types of exchange, that also feels like a blocking type of situation, right? So, for example, patient access or IAS and TEFCA is supposed to be required. Everyone's supposed to respond to patient access queries. we know that's not true. We know
Yeah.
that there are many that do not respond. And we know that there are some that writ large don't respond, right? And so if you're limiting choice and subsequently limiting access or functionality, that feels like a shaky ground to be on. And I would certainly advise that organizations, take a deeper look and figure out how they can maybe provide education to their communities about how to connect safely and give them that choice, give them those options. And then, make the best decision for each organization versus like a blanket writ large,
Right.
we're not participating in whatever it is.
Yeah. Yeah, absolutely. So with our new administration, there's been sort of a lull in movement on TEFCA, but things are starting to ramp back up. And all signs point to like support to keep TEFCA moving. What are your thoughts on that?
Yeah, really feeling a little bit relieved right now that there is we have heard a lot of positive reinforcement. Yes, ASTP and the federal government, HHS, still know what TEFCA is. Like that was sort of our first thing.
Positive number one.
Positive number one, they know what it is. Not to be like a little glib there, but in all reality, it is a small, very small piece of what HHS does. And, we want to make sure that all of this investment that the 9 of us, the 9 QHINs and all of the participants and sub-participants underneath of us have put into this, wasn't for nothing.
Yeah.
So that was good. We do feel like we're going to continue to move forward in a collaborative, way between private and public. Okay, that's good. Unsurprisingly, the ASTP sort of feels that including other government partners is going to be a really big priority for them moving forward. So things like government benefits determination and getting the SSA really engaged is going to be really important and a high priority to them. There, in addition to that, the payer use case, and these are things we've been talking about forever. It feels like just forever and ever and ever. And so, I'm cautiously optimistic. And here at Commonwealth, we've supported these use cases. We believe in them. We also want to see them, have space at the table, have space in the network to do meaningful exchange and reduce burden, on providers and patients ultimately. But there's still, in my opinion, some very real hurdles that we need to get over in order to operate and make sure that this network functions at scale and maintains trust. And I think probably one of my biggest critiques is that we lost at least 6 months of policymaking with the change. And I understand that some of these things do take time. But when you're operating a network every single day, even on weekends, 365, like there is no time when this network is not operating. It's
Right.
all day, every day, holidays, doesn't matter. And when you're operating something like this at this scale, every day counts. Every day that we have policies that make things more challenging or policies that inject ambiguity into what we do, or things that exclude people from participating makes a difference, right? And so when all of those days add up, you're looking at over 6 months of no action. And
Yeah.
that's a really hard pill to swallow for me personally, who's kind of just like a let's get it done type of person, which I know you know.
I had no idea.
Yeah, I know you know that. I'm like, let's go. So I really hope, my hope is that in the next 6 months or, the remaining half of 2025, that we're able to work with, the government to find a balance, find moderation, find a balance between prioritizing some of the less sexy work, if you will, of making sure that the current network really functions well and we remove operational burden, while simultaneously adding in very great, very real, very powerful additional use cases, but there's got to be a balance there. So that's my hope, and that's what I'm advocating for.
Yeah, absolutely. One of the biggest debates that we've seen and we talk about, I know here at Commonwealth, I feel like weekly, maybe daily, is the actual definition of treatment as it relates to interoperability. It's a kind of an ongoing thing. But what are your kind of hot takes on what's happening with that right now?
Yeah. So right now, and I don't know if this is broadly known, it's public information. But right now, the definition of treatment in TEFCA is really limited to covered entities. So you have got to be a covered entity. You have got to be participating in some sort of HIPAA standard transaction, which requires billing in some way, shape, or form, billing insurance, whether that be CMS, Medicare, state Medicaid, commercial insurance. It's got to be one of those things. And that inherently excludes people. And if you don't do that, you're out. Now, some will say, well, Liz, there is another way. And there is a HIPAA definition of treatment that is permitted in TEFCA. But the thing is, like, let's just cut away the BS for a second and just recognize that other way has no requirement that anybody ever respond to it. And I can almost guarantee you that organizations are not responding to it because they don't have to. And we know by the use of implementing standards and implementing requirements, certification requirements, you name it, if it's a should, that means I don't have to do it. So I'm probably not going to do it. It has to be a must. It has to be a shall. It has to be required. So this whole argument of, well, there's another way. The other way doesn't work in reality. Let's talk reality. And so people who, for example, I have over 100 free healthcare clinics that have licensed healthcare providers working for them that are treating some of the most underserved humans in our country that can't get on TEFCA. That should piss people off. But, so far it hasn't, to the extent of making real change or prioritizing change. But it's something that we care about here very deeply. And we're going to continue to fight for, licensed healthcare providers caring for patients should have access to their medical records. And the people that we're cutting out are often, they're not the big health systems. They're not the ones with all the money. They're really tiny one doc shops, free healthcare clinics. Those are the ones we're cutting out. And, we're cutting out, another example, licensed healthcare providers who go into assisted living facilities because the assisted living facility isn't a covered entity. But the licensed provider is licensed, right? Is an MD, is a PA, is a certified nurse practitioner, and we're cutting them out. And so we're saying, oh, well, if you're an assisted living facility and you have a provider that's coming in to treat you in your apartment, you don't count. You don't matter as much. Your provider is going to have a more challenging time getting to your data. And likely you are, managing comorbidities, you're managing multiple issues. And, as someone who's relatively young and healthy, I sort of feel like access to my data matters less than some of these other people where access to their data could be life or death, could extend their time with their family. So it kind of makes me a little angry, obviously, as you can tell. But I think that this is something that needs to be better understood in the broader, industry, that these are the types of entities that currently can't play in the same sandbox together. These are entities that historically have been exchanging data in Commonwealth and care quality, and we're cutting them out of the picture. So somebody's got to bring it up. Somebody's got to talk about it. And I think that is maybe one of the hottest topics that's happening, like you said, sort of semi behind closed doors, that we need to make sure comes to the forefront.
Absolutely. Yep.
Okay. your turn. I said enough. Let's talk about what we've been doing as an organization and what you're excited about.
Yeah, absolutely. I mean, first and foremost, the alliance and the kind of the community that we've built is just amazing. We've added so many new members just since the beginning of the year. To name a few, Agadia, Medent, Savoy Health, Redox, Healthier Clinic, Doc Now, are some of the amazing organizations that we've added this year. You can read more about them in the blogs that we posted on our website too, welcoming them to the Alliance. All of our members have been working really hard to migrate to our new platform, which has, as you know, the robust MPI and is Tufka enabled. So all things that we've been chatting about too. We've been doing a lot of engagement with our stakeholders to help continue to build, a more trustworthy community, which is obviously vital to realizing national interoperability. That's all we kind of talk about is trust and scale and community. We're also huge advocates for data usability, which we chatted about a couple weeks ago with Dee. We are a supporter of the Taking Root movement with the Sequoia Project. So that's also something near and dear to kind of our mission. Patient access, we continue to keep our eye on the prize with that and continuing to talk about patient identity resolution as sort of a key to solving patient access challenges, which we were just chatting about. And then just continuing to kind of push ourselves and the interop community to work harder and smarter to do things well. And, as we kind of look to the future, Tufka is really the floor. It's not the ceiling of excellence and interoperability. So all good things have happened so far. We're looking forward to the rest of the year for sure. So,
Yeah.
I mean,
the floor, not the ceiling. Can't say it loud enough. Yeah,
for sure. So like, as we look to the second half, which I still cannot believe that it's already halfway over, but what are you most excited about for the second half of the year besides the fall summit, which we'll talk about in a minute?
Yeah, I can't have that one on my list because I know you want to talk about that one. So the other things that I'm really excited about, we're currently doing a FHIR work group / like mini testing connectathon here in the Alliance. And it is hard. Like, let's just say, call it what it is. Having a standard like this come into a space where we operate at scale, these two things just historically have not melded together well. We are participating in the TEFCA FHIR work group. That's also not moving super fast. But at the same time, I am optimistic and I am excited because we have members who can test FHIR at scale, which includes the HL7 Fast Security Implementation Guide and the ability to have trusted entities inside of this trust community exchange data with each other dynamically versus needing to call somebody up on the phone and share a secret, get on a GoToMeeting and do it. They can do it in real time dynamically. And we've seen it work. It's been a long uphill battle to get to this point, but we're continuing to push on it because we really believe in adding FHIR and that this will be really a meaningful way to exchange data. With that, I think we're also sort of waiting to see what use cases can FHIR help us unlock. So we're looking to do some pilot mode type of use cases later on this fall. You had mentioned a new member, Agadia. They're all about prior authorization. Prior authorization is a humongous issue, as someone who manages a chronic condition, I know. And a lot of Americans know, right? Prior authorization is a huge issue. And while Commonwealth isn't really set up well to handle the entire prior authorization process as it is today, there's a piece of that puzzle that we can help with. And that's the clinical documentation as evidence to help get that prior authorization through. And so we're going to begin to pilot that effort soon to, again, just help unlock the movement of data to make real outcomes, for patients. So that's a lot going on. And again, outside of TEFCA, right? TEFCA's the floor, not the ceiling. Like a lot still going on, just broadly within the interoperability industry, and here that I think holds a lot of promise, and we're really excited about. What about you? Fall Summit, I know.
Yeah, I know, right? So Fall Summit, I am thrilled about. It's well underway. So we have moved up the date to September. So it's coming up quick. Take note. Registration is open. It's going to be September 22nd through the 23rd this year in Indianapolis, Indiana. So you'll notice a theme of Motor Speedway, throughout all the branding and the website and whatnot. So it should be really fun. Hotel block is open too. We have a really good nightly rate. So while you're registering, book your hotel. It's very limited spacing. I know I say that every time, but it really is this year, I promise. We just posted the outline of the agenda. So if you go to commonwealthalliance.org/summit 2025, it's also just right on the homepage. But you can see the outline of our agenda and all the topics and panels that we have outlined for this year. So that's very exciting. And speaker announcements will be coming really soon. So make sure you're paying attention to that.
We have
and
some
register
good
now.
speakers. Yeah, we have we have a lot. So over the years, we've transitioned it from being less of Commonwealth talking, even though I know people love to hear my voice, and more of other people from the industry coming in and talking. And we've opened it up. It used to be members only. Now it's anybody in healthcare, health IT, but really it's an interoperability focused summit. So anybody is welcome, especially if you're in the interop space. Even if you're not a member, come hang out with us. We're super fun. We like to have a good time, but we like to be really serious about really serious topics too. And we're bringing some cool speakers. So likewise, very excited.
For sure. Yes. And we also have our reception the Monday night, and it's going to be at 5 Iron Golf in Indy. So kind of a fun and exciting event too. We'll have golf simulators, all kinds of fun games and whatnot. So have a cocktail, have a soda, have some fun. So that'll be Monday night too. So make sure you're there for that as well, unless you obviously can't, but be there Monday.
Yeah.
And then I just wanted to touch on some upcoming resources and new stuff that we have. I created a new FAQ for Commonwealth that is downloadable on our website. And we've got some new demo videos on there. So be sure to check out our resources page while you're obviously booking your registration and hotel for the Fall Summit. And then last but not least, make sure to join us next week. We're back to back since we had to flip flop some episodes because of holidays and whatnot. So we'll be back next week on the 17th with a special guest from Clear to talk about identity management. So that'll be a good one.
That will be.
We'll see you then.
Very good.
For sure.
Thanks.
Bye, all.